You know, teeth are so important, our mouth. You know, it just shows us, it shows people who we are. First impression is the most important, don't you think?
I think so. Bright smile is good.
Bright smile, absolutely. As you know, as boomers age, many start to lose those bright smiles. Teeth start to lose a little bit of whiteness. Cosmetic dentistry has now come in and become a huge, big business. When it comes to boomers, it's all about how you look, and of course they want to look good, they want to feel good. Dr. Paul Coleman, one of the top cosmetic dentists in the country, he's here to tell us how to keep that perfect smile. Please welcome to the Boomer Show, Dr. Paul Coleman. Yeah. Oh, yeah. You know, cosmetic dentistry has become so huge lately. It's huge. You're in the right business, Doc.
It doesn't stink.
No, I would think not. How important is your smile?
Well, it's said that the eyes are the window to the mind, but the smile is the window to the soul. You've seen people walk into a room and they just have this smile. You've heard it. It lights up a room.
Right.
And when someone possesses that kind of smile and the self-confidence it gives, it permeates their entire existence.
It certainly does. And one of the things that occurs to all of us as we get a little bit, all the boomers are getting a little bit older, as they approach these next 50 years, one of the things that we're concerned about is the color of our teeth. They start to fade. What happens? What's the process there?
Yeah, a couple things happen. As we beat up our teeth and grind on them and use them, the nerve bundle kind of shrinks down inside the tooth. So if you took an x-ray of an 8-year-old's front tooth, the nerve bundle's huge. Yeah. But as it calcifies down over age, red blood cells get trapped, and it kind of stains the tooth a gray from the inside out. So you can seldom see a 65-year-old with a nice, bright, white smile that they may have had in high school or junior high.
Yeah. But it's, why does that happen? Is it just an age process?
It's just part of the body's defense mechanism. As that canal shrinks down, the red blood cells gets trapped, and that's what stains the tooth darker.
What about you go to like Walmart and all these stores, and they've got these toothpastes. Some of them have baking soda. Some of them have whiteners. Some of them have all kinds of stuff in there. How do you decide which toothpaste to use?
It doesn't make any difference because they don't work that well. So you can, if you're very religious about it, affect some small amount of change with toothpaste. Right. All bleaching is basically a hydrogen peroxide compound of some concentration and delivery system. So as you use this stuff, you can get teeth a little whiter with the toothpaste.
You said a little whiter.
A little bit. I mean, don't expect much.
No.
Now, it really depends on what you start with. Everybody's got yellows and grays in their teeth. Yellows bleach better. If somebody comes in with a mustard yellow, that's going to bleach better. Grays are stubborn as a dickens. Yeah. No matter what system you use, that's not going to have the same profound effect.
Now, what about all this stuff that you see in the paper, Zoom and Zoom 2 and Zoom 3 and you know, all these different dyes and stuff like that? Does that stuff work?
Absolutely. I've bleached teeth now, unfortunately, almost going on 30 years at this point. And traditionally, we've made trays, and there's a concentrated gel that gets applied. But you got to kind of wear them a lot. You got to wear them for hours every night or overnight, and weeks, perhaps months of doing this. So people don't tend to want to make that kind of commitment. Right. Now, the power bleaching system in the office is a much more concentrated solution. So you can, in fact, I brought a photo along today with typical result. It's a light-activated system. Everything has to be isolated, and that's an example of a before and after that we did. The kind of yellow thing on the side there is a shade tab. That's what color their teeth were an hour and a half previous.
No kidding.
So we just held it up to show the difference of that we affected. Now, it's kind of boring lying there for an hour and a half. So in our office, we actually install flat screens in the ceiling. Sure. So people bring in DVDs or they watch satellite TV, and they can't quite get through the movie, and we can affect that type of change for their teeth.
That quickly? Yeah. That quickly. That's amazing. Now, do you recommend boomers should use this procedure?
I think it's a splendid procedure. I mean, it's almost run as a loss leader in most offices. I mean, you can get it done for about $500.
Right.
And
is that each tooth?
Pardon me?
Each tooth?
I wish. No. And in my office, that includes some follow-up trays and some extra gel in case you want to touch up a couple weeks down the road or a couple of months. And it just frankly works. It always startles me that it actually stays as white and stable as it does for as long as it does.
Now, do you, let's take a look at another photo. I know you brought another one with you. Explain to us what this is.
Okay. Bleaching is like the most common thing, but the most popular and the thing that's really going to revolutionize our business is the ability to bond pieces of plastic or porcelain onto teeth. Really? So if someone comes in and they look like a pumpkin and they've spent their entire life getting those lips together every time somebody picked up a camera, we can add some porcelain to those teeth and do what's called a veneer, just like the veneer on our tabletop here. And that's a before and after. We veneered all the front teeth. Same teeth.
Oh, my gosh.
And that was 2-3 hour visits.
Wow. Just like that?
Yes, it's porcelain, it's bonded on, solid as a rock. We can stick the porcelain on with the same strength that the enamel stuck to the original tooth. Now, a case where it's spacey to begin with, that's the easiest one because you don't have to like think very much. Right. You're sort of making them bigger, you don't have to reduce much tooth. But in cases where they're crowded or overlapped and things like that, you got to do a little bit more careful planning, but you can affect the same radical changes in 2 visits.
So we have another photo here. Let's take a look at another one here. Some of this stuff is unbelievable. Here's a lady.
Delightful lady. I love Liz. She is just a hoot. But she had her 2 lateral incisors kind of like sticking straight out towards her lip.
Right.
And, you know, there were different lengths, and so we really try to analyze what's going on here, what do we want to change. So we kind of overshaped the laterals. We did 8 veneers, and she's one of my biggest fans now. She's turned into a missionary.
So this is the after.
This is the after shot.
Wow. Boy, she looks happy there. That's it right there, huh?
Yeah.
That's her?
That's her.
That's the same lady?
Same lady.
Oh, my gosh.
Dr. Paul, people are going to want to know, can this be covered with insurance or portions thereof? Or
Not as a rule. Not as a rule. If you had large fillings, if you had things that were in there before, you might get some benefits. But if you think about dental insurance, it's like a hospital gown. You only think you're covered anyways. Right. You know?
Ooh,
so
I like that.
So you get like, so you get your $1,000 or $1,500 a year maximum.
Yeah.
So that'll cover, I don't know, one of these teeth. Okay. You know? So no, it's really not something that we get, you know, that we count on. Yeah.
You know, when you look at these, we have one more picture. Let's show this next one here. This is pretty fascinating. Now, here's a lady.
Okay, this is a boomer problem. Yeah. There was a drug released in the 50s called tetracycline. Still used today, yeah, right. Tremendous antibiotic. What they didn't know when it first came out, if you give it to pregnant women or women whose teeth are, or kids whose teeth are forming at the time, right. The kid's going to show up with these dark bands. The tetracycline got into the tooth, and you had this permanent gray stain. You could no more bleach this than the man on the way. There's no way in the world. Oh, my gosh. So this woman was actually a smile makeover candidate that we did, where we got rid of all the crowding, we covered all the colors. We actually did all 28 teeth in her mouth.
That's the finished product?
2 6-hour visits.
2 6-hour visits? That's the final product?
Correct.
That is incredible. Boomers have to be flocking all over the place to get this stuff done.
It's become very popular. It really has. And the problem is there's no such thing as a cosmetic dentist specialty. The ADA does not, it's not like an endodontist, a root canal guy, or an oral surgeon. So anybody that feels like it can put this family dentist, cosmetic dentist sign on the front door. Doesn't mean they know how to do any of this stuff. But legally, they're allowed to.
Right. Well, I have a friend. And I've had since we were kids. Mm-hmm. And he, you know, he's the life of the party. He jokes and laughs all the time, but when he takes a picture, he always closes his mouth because of his teeth. It affects your personality, doesn't it?
Absolutely. I had a rotten grill for a long time. Peanuts out in the room.
Peanuts out in the room.
So I actually grew a Craig Stadler mustache. I looked like the walrus. I covered it up, you know. Oh, right. And then I had my teeth fixed, and now when they pick up a camera, I just have to suck in. My God, I don't have to worry about the smile.
That's all of us. That's all of us, Dr. Paul.
You know, fascinating subject, and we appreciate you being here to teach us a little bit more about this. Boomers, of course, you know, you're leading them down the path, buddy. Good timing. Appreciate that. Dr. Paul Coleman and Scott Bowman coming up right after.